My name is Malda, and I would like to make a case for additive manufacturing orthoregeneration as the next topic for the on EORS Kickstarter grants. We all know that the regeneration of damaged joints is a very challenging issue. However, significant progress has been made with the use of orthobiologics. For example, with the use of allogeneic and autologous stem cells and their secretome, by the use of PRP and platelet lysate, by the use of specific growth factors to induce tissue formation. However, despite these promising results, even in clinical trials, an important aspect is overlooked. And that's the fact that durable mechanical restoration of the tissue is not achieved. And I'll try and explain to you why. Because the mechanical stability of the cartilage is provided by an intricate network of collagen type 2 fibers in the surrounding proteoglycan-rich matrix. One can visualize this collagen structure by polarized light microscopy or by electron scanning microscopy. And one would find that there's a very specific organization, an arcade-like formation, also known as the Benninghoff arcades. Well, once this Benninghoff arcade structure is damaged, for example, due to degeneration or due to an acute trauma, this structure is not restored. A reparative tissue can be formed, which is rich in proteoglycans, as well as in collagen type 2, but it's not remodeled. And we know that the turnover of the collagen type 2 network is actually close to zero. And this urgently requires that we rethink the current paradigm of regenerative medicine for articular cartilage. And I believe that additive manufacturing can aid the further development of more durable implants. I'd like to show you an example why. Here you see a composite implant with a bone and a cartilage face. The cartilage face is composed of a hydrogel reinforced with thin fibers. In this way, a structure is obtained that has mechanical properties close to the native articular cartilage. Because these fibers can be made of slowly degrading or non-degradable materials, is also providing a long-term stability. We've demonstrated that cartilaginous tissue formation can take place within these structures. But more importantly, in a long-term equine study, we looked at the performance of these implants. And we saw after 6 months that the mechanical stability of these implants, cell-free or pre-cultured with cells, were maintained. But more important, the cell-free structures that did not contain any matrix did contain a cartilaginous matrix after 6 months of implantation, to the same level as the cell-laden one, and even slightly above the pre-culture baseline. So this underscores the crucial importance of the restoration of the mechanical environment for repairing the damaged articular cartilage. And additive manufacturing can help, but it has another advantage. Additive manufacturing, 3D printing, is based on imaging. And we can use personalized patient imaging to create personalized tools, but also personalized living implants that follow the contours of the joint. So, as additive manufacturing is already a clinical reality in orthopedic implants and the development of orthopedic tools, as well as 3D printing techniques using cells, we call that biofabrication, can actually provide shape and stability to living implants. I believe that an investment in additive manufacturing for orthoregeneration is timely and warranted. I thank you for your attention.
Welcome everyone. We've just seen a fascinating presentation on additive manufacturing. But let's face it, these are merely gadgets. At the moment we are looking really hard to find opportunities to apply them and use them for the improvement of healthcare. So let's focus on a real problem. Osteoarthritis affects many of us. More than 300 million people had osteoarthritis in one or more of their joints in 2017. And this problem is predicted to increase even further. And in 2040, the number will be doubled. This is due to the aging population, an increase in obesity, and an increase in sport-related traumas. But despite this very high number of people affected, we have no cure for osteoarthritis. We try to keep people mobile by painkillers, by physical therapy, and eventually by replacing their joint with a prosthesis. But this is not the best option for everyone. So this is why I would like to convince you to use your Kickstarter grant for osteoarthritis orthoregeneration research. Osteoarthritis definitely needs more research. It is a complex disease. Multiple tissues are involved. Cartilage, bone, ligament, synovium are all affected, and they interact with each other. The disease is multifactorial. Aging, obesity, overloading, trauma, genetics all play a role. All patients are different. We need to know more about this heterogeneity between patients in order to treat every patient successfully. Generally, patients visit their doctor relatively late in the disease, when there is already irreversible tissue damage. We need to know more about these early phases. We need to know what happens, how can we diagnose the disease, and how can we intervene. And when a patient comes with irreversible tissue damage, how can we repair it? So there is a lot to discover out there. But why would you work in osteoarthritis and regeneration? In additive manufacturing, high-impact publications and fast caching might be easier. Well, osteoarthritis is a fascinating disease, and the research is very diverse. You can work with different tissues, cartilage, bone, synovium, ligaments, or a combination of them. You can study biomechanics, genetics, or cell signaling. Work with cells, animals, or patients. And focus on the field of imaging, immunology, big data, or tissue engineering. So there's an opportunity for everyone. You could even use some of the tools just explained by Jos, but now for a real defined purpose, osteoarthritis research. So before you vote, I would like you to consider the following. Osteoarthritis needs you. It needs more research, it needs more knowledge. It needs young, bright and enthusiastic researchers. But osteoarthritis also has something to offer. It offers a significant societal problem to work on, a large, inspiring community, and a diversity of methods, approaches and challenges. Ladies and gentlemen, there's lots to be learned, and these ON EORS grants, although not very big, can make a real difference. Many small steps make a big leap. But more importantly, having you involved in osteoarthritis research in this fascinating world will not only help society, but it will also help you in your scientific or medical career. These presentations by Jos and me were announced as a battle, but I think it's more like an election, and that's why I would like to make you a promise. If you vote for osteoarthritis orthoregeneration research, you submit a proposal and you win, I will be available for advice on your project, of course only if you like it. I have more than 30 years of experience in osteoarthritis research and more than 25 years in tissue engineering and regenerative medicine. And of course I do not know everything, but I will also make my network available to you. So thank you for your attention, and now it's up to you to vote.